Hello and welcome to the Welliverse with Tim and Chris.
Hello and welcome to the Welliverse.
I'm Tim,
I'm Chris.
and it's been a long time.
It sure has. We have not made a podcast for months now. And we keep saying, we really should. But we really are.
Yeah,
We're really here.
Explain yourself. What have you been putting your energy into this past 8 weeks?
I have been a little, unwell, or no, not really. Making a bit of a shift personally to, just change some of my habits to de-stress. And I think in focusing on that, some things have had to take a back seat, which is fine. That's life. But I'm so happy to be finding a balance and feeling like I'm, getting more on top of things.
Mm-hmm.
Yep.
I read your blog post.
Ah, yes,
I
that
agree.
was a good one.
Moving to flourish rather than moving to punish. Were you really trying to punish yourself?
Oh, I don't think that was my intent, but I think that what I was doing definitely wasn't doing favours for my body as a whole. I think it's like you have to reflect on what you're doing, and periodically everyone should be reflecting on the balance of what you're doing in terms of your training and seeing if it's actually the most useful thing, because more isn't always better.
Mm-hmm. I believe that people can prioritise things in any order that they choose, but you do need to prioritise them. So to say something like, I really would love to, I'm sorry, but I can't. For most things, you can. It's just that other things, probably good things,
are more important.
So, sorry, mate, love to come out to the pub, but I just can't because stuff. And, not going to the pub and can't is,
You know what, though? I feel like we're not allowed to say, I just don't want to as much as I want to do this other thing. We're afraid of hurting someone's feelings or...
No, do it. Look, I'd really like to, but I'm actually going to prioritise this aspect of my life.
Yeah.
I'm going to spend time with my wife. Thank you so much for the invite, but let's just be honest. Be real. And
I'm with you.
Yeah.
I just feel like it's not socially acceptable.
It's a false economy.
I'm with you.
Just be real. And if they're like, that person actually prefers to go running on a Sunday morning than out on a Saturday night, well, if they really believe that, they're not your friend. See ya.
Okay, what about you? What have you been putting your energy into?
Working hard at the mines. This past week, you may have noticed, Chris, I did feel a bit sick. I had a bit of a...
What? That's flown under the radar.
Yep.
Not.
But I'm feeling better now.
Yeah, well, I'm glad. Poor Tim. No, you actually have been quite sick and lots of coughing, which is actually what's led us to our topic for this week, which is the cold and the flu. A cold, the flu.
Bit of an in-joke. I just want someone to tell me why we refer to it as, I've got a cold, but, I've got the flu. If anyone knows, let me know.
Yeah, Tim's he is mystified.
There's lots of different flus out there, so I could just have a flu. But no, you get the flu. Explain.
I've got the black lung.
Papa.
Anyway, there's a few things that we find really interesting with this topic. It is cold and flu season, so there's a lot of it going around, and I feel like, I don't know if it's Australian society, but we're all pretty bad at actually taking time off work when we're sick. So that's one thing we want to talk about, sort of the attitudes surrounding that. We want to talk about how exercise affects your susceptibility to getting the cold and the flu.
Mm-hmm.
And we really wanted to have a look at a doctor's perspective on these things, because this time of year, doctors are just copping it with everyone coming in and thinking they know everything about the cold and the flu and their symptoms and la-di-da-di-da. Tim's lucky enough to have a friend as a GP, and he asked her a couple of questions.
Yeah, I just said, hey, Manisha, if you wanted people to know stuff about colds and flus, what would you say? And she's given us 3 awesome points. So we're just going to base most of the discussion around the stuff she said.
Yeah.
I'll read out what she's messaged to me, and then we're just going to have a chat about it.
Cool. Yeah. Okay. So the first thing that Manisha was telling us about was to do with antibiotics when you have the cold or the flu. So she talks a little bit about people coming in and sort of requesting antibiotics to fix their sickness. Let's go.
And this is what she said. Colds and the flu are caused by viruses which are not treatable with antibiotics! Exclamation mark. Every time you show up to your GP requesting antibiotics for your cold, your GP dies a little bit inside. We also die a little bit when you say, but doc, whenever I get a cold, it goes to my chest. Dry coughs are not unusual as part of viral infections and are a particular feature of influenza. Your pulling out the chest line is not going to convince the GP for them to prescribe you antibiotics. If you do end up with a bacterial infection, which usually involves a cough that's productive of thick green or yellow sputum, the best course of action is to see your doctor again for reassessment and further management. The best cure for colds is to rest up, drink plenty of water, and eat healthily. She does say there is a drug called Tamiflu, which GPs occasionally use for patients with confirmed influenza, but only is used in highly specific circumstances, such as if the patient is immunosuppressed, so really old or unwell.
Yeah, okay.
Furthermore, Tamiflu is only really useful if taken within 48 hours of symptom onset.
So, okay. I don't know whether it's a generational thing, but a lot of the older people in my life say, what, you're sick and you're having another day off? Oh, you need to get on the antibiotics.
Yeah.
So is that a generational sort of, that was the answer?
Yeah, I suppose.
I
People
think so.
of your parents' generation,
Yeah,
of our parents'
yeah.
generation.
So like baby boomer generation.
Yeah, because antibiotics have only been around since World War II, really. And before that time, you'd get a cut on your leg, it'd get infected, and
You'd chop your leg off.
You'd chop your leg off or you'd die.
Yeah.
So
Yeah.
people through that generation have
Simpler
grown up saying
times.
like, antibiotics will like literally have changed
They're
the
a
world
miracle.
and will cure anything.
Okay, and which was kind of true to start with, but what are the
Well,
problems?
for a bacterial infection.
Yeah, okay,
So colds and flus are viruses, so they're not even going to have an effect. And in the end, it's probably better for your immune system to be able
not
to
have
deal
them.
if it can, and have some appropriate relationship with your doctor. And
So that's actually a common misconception, that antibiotics are going to help your cold or your flu. They don't.
no,
No.
If-
Okay.
If on top of being really ill, you end up with a pneumonia, then maybe
Okay.
that's a bacterial infection in
Yeah.
your lungs. But
All right. So it's more if other illnesses, which are bacterial infections, develop as a result of your suppressed immune system.
yep,
Yeah, okay, I see. Yeah, it's interesting though that like this whole superbug thing is a thing.
yeah. So downsides of antibiotics.
Yeah.
Yeah, so people love to go into their GP, and obviously they're in distress. They can't breathe, they're coughing, they can't sleep, they're tired. Just please give me something. It's 2017. We need I demand science. What can I take?
Is that your outraged old lady voice?
Yeah.
I demand science.
Yes, it was. And they want something in tablet form,
That will get them
that will help
better.
them. So, just eating well, drinking enough fluid, and resting. It's like, oh, come on, give me the edge.
Do you think we're not patient enough with colds? Because
course, we've got stuff to do.
Yeah, you actually need to let things run their course, don't you?
Yeah.
I do sort of expect that things should be able to be fixed quite quickly with medication. And I've always thought of myself as someone who goes the non-medication route just because I just think I should be able to get better on my own. But really, if it's something like a viral infection, then that is just the way it is.
Yeah, but you go to your doctor, you ask the questions that you think, and they'll give you the answer that is.
Yeah.
Hey, doctor, should I have antibiotics for my cold? Sorry, mate, no. So, if you've got questions, you go and seek answers from qualified people. But what we're talking about is antibiotic resistance. One of the big reasons to not start just throwing antibiotics at everything in case it just might help. Maybe it is some kind of infection inside my lungs that antibiotics would help. Just can I take it just in case? That would not be a good idea.
Yep.
So since antibiotics have been invented, there's been the development of bugs that have become resistant to a whole bunch of different type of antibiotics, and especially older people or very young people, they somehow get in contact with a bug that's become resistant to antibiotics, and they very, very ill. Yeah, it's a problem. So that's antibiotic resistance or superbugs. The other part of it is just taking antibiotics makes you feel rubbish. It messes with all the microbiota in your gut that you use to actually digest your food, and even make your neurotransmitters in your gut. So you take out all of those bugs, the healthy, happy bugs, and you'll feel lousy for weeks. Yeah.
Interesting. All right. So the next thing that Tim's GP friend Manisha said, we sort of wanted to know what the difference between a cold and a flu is, because
Aside from a cold and the flu.
yeah, I feel like in my experience, when people say they have a cold, it's like, oh yeah, you can carry on, you can soldier on with a cold, blah blah blah.
Yep.
But if
Marketing.
people say they've got the flu, then it's like neck level. Like they were in bed with sweats and shivers, and it's kind of like what we say to let people know it was a really bad
Yeah, I'm not just messing around.
Yeah, I had the flu, legit, 100%.
Okay.
Yeah.
The flu knocked your IQ down a whole bunch of points.
100%.
100%.
Yeah. So here's what Manisha actually said, though. So this is GP's opinion. Oh, not opinion, fact. There's a big difference between a cold and a full-blown influenza. And full-blown influenza. Colds are generally caused by rhinovirus and tend to involve more localized symptoms of shorter duration. Influenza lasts longer, 5 to 10 days, and involves systematic symptoms such as fevers.
Systemic.
Oh.
Soz.
No, don't be sorry. I'm sorry. Involves systemic symptoms such as fevers, muscle aches, and extreme fatigue.
It means through all your systems.
So, guys, if this is your first Welliverse episode, I just need to remind you, or tell you, Tim and I are married. Just saying. Anyway, let's continue.
Okay, what I wanted to talk about, because thanks, Manisha, that seems to make a lot of sense. So colds and flus have pretty similar symptoms. Flu is worse, which is the way we normally differentiate the two. Flus are lasting sort of 5 to 10 days, and you're going to have strong fevers, muscle aches, and be pretty well laid down.
Okay, so it kind of is probably what people think, but I do feel like people bandy the word flu around just to sort of say, take me seriously, I was pretty sick.
Yes.
Okay.
Okay, I've got a question.
Ask me.
So when you've got a cold or the flu and you're feeling unwell,
Yes.
the best advice is to drink enough water, eat good food, rest.
That's good advice for life, but yes.
What other things do you know of that people take to try and give them the edge?
Chicken soup.
Chicken soup, yeah? Keep going.
And hot lemon water with a bit of honey.
Yep.
I was going to say flat lemonade, but that's for tummy troubles, isn't it? Demazin. A Vicks tickle.
Okay. Yep. So Vicks Vapor Rub, a bit of an Aussie thing.
Yeah,
Kind of
on the chest,
menthol
on the chest, and just on the what is it?
No.
What's this bit called?
I don't know. Menthol to open up your airways.
Yes.
Okay. Anything else you can think of? Like things you'd go to the chemist to buy?
The vapor thing that you shove up your nose.
Like an aerosol decongestant?
Yep. Panadol.
Yeah.
This is.
Or Nurofen, another over-the-counter.
Yeah.
Yep.
Other things you would get if you've got a cold: vitamin C, oranges, and vitamin C tablets.
Okay.
Mm-hmm.
Yeah, that's a pretty good list.
Thank
You win that game.
I am ready for parenthood.
Okay, do you know what things your GP might actually recommend you go and spend your money on?
Water.
We'll just get that out of the tap, the GP would probably say.
Oh, eh, no.
Okay, so the things that
My fabulous thinking noises.
there's not much that can reduce the duration of your recovery. Your body's just going to deal with that. But those drugs that can help reduce the symptoms of cold and flu are recommended when used appropriately if there's no other health concerns that stop you from taking them. So things like Panadol, you can take your 2 tablets a couple of times a day as long as there's no problems with your liver.
Yeah.
That's going to help reduce your temperature and
Yeah.
reduce that feeling of pain. Same with Nurofen, it will reduce your temperature and reduce pain too.
Do cold and flu tablets dry you up?
Yeah, so cold and flu tablets normally have paracetamol, so Panadol, in them, and they also have
I want to say antihistamine. Is that a thing?
that's a separate, different thing.
Oh, okay.
So your cold and flu tablets normally have paracetamol as well as a pseudoephedrine.
Pseudoephedrine. I've heard of that.
Yep, or some other variant of a decongestant that will help dry you up and open your airways. Yep. Okay. So those things will reduce the symptoms. They won't actually modify the progression of the disease.
All right. So it still has to run its course, but you can sort of feel a little bit better.
There's no particular evidence for vitamin C, for echinacea, for what else did you say? Like things like chicken soup, there's actually looking at evidence. Like if it feels good, you can definitely do it. It's not going to hurt, but it doesn't really reduce your, there's no magic in it that's going to get you better and back to work
okay.
quicker.
Can I ask something? I think this is an American thing. Humidifiers?
Yeah?
Sweating out a fever?
Well,
Is that a
probably two different things.
Okay.
So breathing in hot, moist air could definitely make you feel good because if you're kind of dry and crusty and got all this, junk in your
Grossness.
face, then breathing in hot, moist air mightn't be a bad idea. As long as it's clean and you take some big deep breaths and cough up a bunch of junk, that's not a bad idea.
And what about
Do it in the hot
the
shower.
whole sweating the fever out thing?
Yeah, well, your body's temperature does increase when you're unwell because that's your body working. Your immune system and all of those little T cells and B cells and little bits of blood cells are going in and working on stuff. So that all that activity increases your body's temperature. But cooking yourself does not help.
Okay.
So stay appropriately normal body temperatured.
All right.
Yes.
The next thing that we wanted to talk about, which is probably it's an annoying issue for me, and I don't think that a lot of us get it right, but I think it's problematic, is do you work or do you not work when you're sick? Do you go or do you not go?
When to sort of text your boss,
when's the
or
line?
call in to the front
Yes.
desk at work and say, I'm sorry, I'm so sick, can't come in. Hope to see you. Bye soon.
Trail away. Yeah. Yes. So something that's, well, I work in a school. So this is a annoying thing for me because if I'm sick and I don't come, there's a lack of continuity for the kids. They're only in year 1 and year 2, so they are quite dependent on their routine. La-di-da-di-da. I know life happens, but there's also the pressure to just come anyway because I'm the captain of the ship of that class, and if I'm not there, then things don't happen.
The way you want them to.
Well, no, not the way I want them to. Things don't happen on the schedule and the time that they're supposed to, according to the syllabus or the outcomes or blah, blah, blah.
Kids need that. Okay, kids, go face the corner, all of you. But there's only 4 corners. Do it. I'd be the best substitute teacher.
You would be.
Yep.
Yep. I had a substitute teacher. His name was Mr. Justice, and he wore his pants up super high, but they were shorts. And he also wore really long socks, and his name was Mr. Justice. How funny. Anyway.
He sounds suspect.
He does, doesn't
Did he dispense any justice?
He's probably dead by now, Mr. Justice. Anyway, to work or not to work, what does Manisha, your GP friend, say?
The last little bit from my GP friend. When you're unwell, please do everyone a favour and stay at home. Rhinoviruses and the influenza virus are readily transmitted via airborne droplets, those same droplets that you cough and sneeze out. It doesn't take much to pass on your illness to basically everyone around you. Although you might think that you're demonstrating how tough you are by showing up to work when you're unwell, not only will staying at home give you a chance to recover, but it'll also protect your friends, workmates, and unsuspecting fellow commuters from falling ill.
Yes. Look, I agree wholeheartedly with her. I do think, though, that it's not as simple as that, because there is a lot of pressure on people to show up and do their job, and often other staff members are placed in a position of having more added to their workload if someone's sick. I know that that's what happens at school, so you're always like, oh, do I call in sick or do I just come and battle through? Because you really just don't want to put that other pressure on everyone else who's still there. At the same time, though, turning up sick makes everyone else sick.
Yeah, so it might be your short-term gain. Like, I turned up for a whole 2 days.
And it's also
and
your
then
children.
I got everyone
Yeah,
else
you've got to
sick.
think about the kids. I mean, it depends what work you're in. Tim, you work at a hospital. I'm sure it's not the best for you to show up sick, because there's a lot of...
Hello, Ethel. Oh, aren't you a lovely 97-year-old lady? Oh, dear.
No, that's a bit depressing.
Yeah.
Yes. So I think it is important to know, to actually take ownership over your stage of sickness and be like, yeah, I'm calling it. Like, I have just realized that I am sick, which means I'm contagious. You know, it's not like I think there is an actual point to saying to the GP, hey, when is it okay for me to return to work? Like, GPs, in my experience, really err on the side of caution. They say you should stay off work for the next 2 or 3 days, and they give you a certificate for that. And I think, you know what, I'm going to use that, provided I, can, because that's
what it's there
the
for.
recommendation. And that's, but yeah, Tim and I were talking about this before, and he said, what about people who are paid casually?
I think that's an interesting
Yeah.
thing. Like, someone who, if they don't go to work, they don't get paid. Well, they might wake up and think, I feel rubbish. Can I get out of the house? Can I make it to work?
Yes, I can.
That's going to be an extra however much in the bank, and we're not going to fall behind on our mortgage, and we'll still be able to do the groceries on the weekend. But what that means is, if you're there coughing and doing whatever you're doing at work, and
Someone else gets sick.
you get a co-worker who's in the same situation as you sick, you've done that to them. And if they take that time off, that's on you. So my opinion, which I'm lucky to be able to have because I'm a full-time employee with sick leave, is you get casual loading, 25%. That's designed for you to
it's there to
put somewhere and
be
say,
a safeguard.
if I get sick, that's what I use.
Yep.
So use it.
Yep.
Stay home if you're sick.
Yep.
If you've got a fever, if you're coughing.
And if you are in a managerial position and you have employees who are sick, I don't know if they realise the pressure that they put on these people, but try not to put pressure on your staff to come in sick, would be my opinion. Because even if it's not their intention, I feel like that's the expectation, that you come in unless your head is on fire. Yeah, there was one other thing I wanted to say on this point. What was it? Oh, yeah, I think different families sort of have different standards with this. I remember my mum was very much like, you are not sick, you are coming to school,
But Mum, my head fell off.
Well, no. I mean, it's really difficult with kids, I think, to know when to actually take them seriously and la-li-da-li-la. And I think when, like, the experience that I have with all my school kids, oftentimes they'll come into school and they're coughing and spluttering, and, the parents could have kept them at home, but I think, well, maybe they physically cannot keep that child at home. They've got to go off to work, It's this big vicious cycle of getting sick.
Okay, I've got another question.
All right, what is it?
Do you know why we get more sick during winter?
No, and is it a myth that being cold will get you a cold?
Well, I've heard things to say that the colder air does change the shape of your airways a little bit, and there's a theory with no huge amount of evidence to say that when your nasopharynx and the way you breathe in through your nose is a little bit colder, the bugs can hang around in there a little bit longer, and you might be more at risk of getting sick.
Yes.
But the main actual reason that people say you get sick in winter is because you spend more time indoors with a whole bunch of other people. So instead of
Yeah.
being outside,
Yeah,
being spread out a little bit more,
totally.
being in the sun, which is going to kill all that junk,
Yeah.
you're just sitting closer to each other.
Completely. Okay. So it's more just the things that are attached to the cold weather, the habits that we do in winter. Yeah, that makes sense. Rather than the actual cold weather, it doesn't like breed more bugs. It just
Yeah, don't go out, you'll catch a cold. I'm like, well, don't cough on me and we'll be fine.
Okay. All right. The last thing we wanted to talk about, I think, was exercise and sickness.
To work out or to not work out?
When
That
you
is the
are
question.
sick. It is a question because I have been guilty in the past of having a sick day, like being legit too sick to go to work, in my opinion, and in a doctor's opinion. You know, gone to the doctor, they've said, yep, you know, I can like listen to my chest with a stethoscope, blah, blah, blah.
You've got a
I'm
temperature.
sick. Yep. But, and I'm talking about a time where I was doing marathon training. So running, you know, 60, 70, 80 Ks each week.
Mm-hmm.
And I would think, okay, well, like I did have a 20K run planned for today, but because I'm sick, I will dial that down to a 12K run.
Mm-hmm.
And completely was able to do the run. Yeah, felt a bit like, but felt better for getting out and moving, even though I was sick. Now, I remember feeling really guilty that I was sick, yet still exercising.
You terrible person.
But what do you think? What is the actual science behind being able to exercise while sick? Does it help? Does it hurt? What is it?
Well, there's definitely guidelines. There's some animal studies where they actually inject rats with sick bugs and see what happens if they are made to exercise or made to rest or made to exercise just a little bit, which is interesting. Mm-hmm. And there's also the effect that long-term exercise and how hard you exercise regularly has on your chances of actually getting sick. So in your situation when you've just fallen sick, and
So when you're already sick?
Yep. Whether to exercise or not, the guidelines normally, if the symptoms are above your neck, so it's just a runny nose or a bit of sneezing or watery eyes, you're probably okay to go at a moderate intensity. But you may be better off just to leave it a day and then decide.
All right.
If the
so do
symptoms-
take a day's rest.
Yeah, you're not going to die.
Yeah. Yep.
And it may just give you that little bit of extra reserve to recover quicker.
And it's funny because it's all so relative. I mean, some people happily go days without exercising and that's the norm for them. But for people who exercise 6 or 7 days a week and they actually have a plan, they have a schedule, they have a program.
Yeah. But does that mean the exercise is owning you? And if something wrecks that plan, then your brain's going to melt?
I'm thinking that.
Maybe you've got other issues.
Yeah, but I think it is all a little relative. And it is. Your fitness level, what is moderate for one person, might be quite intense for another person.
Yeah, but you can judge moderate based on
Your
heart rate.
Okay.
So
all right.
moderate exercise would be, most people's normal resting heart rate is about 60 or 70 beats a minute. Moderate intensity exercise, which is a brisk walk, should elevate your heart rate to about
60% of your max. Ish?
Yeah. So
Yeah.
60 to 70 would be about 120 beats a minute. So
Okay.
that's an appropriate moderate intensity exercise. And you're probably okay to sit there. If you feel well, then it doesn't, trash you afterwards.
Yeah.
The recommendations that talk about what happens when you've got symptoms below the throat. So you've got, moist cough, any kind of cough, vomiting,
Or digestive,
diarrhea,
yucky, yeah.
is don't exercise.
Now, why is that?
Because it's more serious. Your whole body's more involved. Chances are you've got a fever and you need that energy.
And the muscle aches and the fatigue and the dizziness and
just,
the okay.
Just
Yeah,
rest.
it's just not a good idea.
Yeah. So there's actually guidelines about what you should do. Do you want to hear them?
Oh, I really do, Tim.
Okay, let's have a look.
Bum, 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 bum. Oh, sorry, he's ready.
I'm ready for ages. Okay, day one of illness. If you've only low intensity exercise with symptoms like a sore throat, coughing, runny nose, or congested nose, no exercise at all when experiencing muscle joint pain, headache, fever, diarrhea, or vomiting.
Ugh.
Day 2 of your illness, if your body temp's greater than 37.5, when your normal body temp's sort of 36 to 37, don't exercise. But if there's no fever and you feel okay and no worsening of your above the neck symptoms, then light exercise at that sort of 120 beat per minute, moderate intensity is okay. And the key thing there is by yourself indoors. So you don't go to the gym and go and cough on everyone.
Yes,
Yep.
love it. Yep.
Day 3, if you've got symptoms, go see your doctor. You may have had to go see your doctor straight away to get a sick leave certificate for work, but
if you haven't already,
if it's still kind of day 3, it might be a good idea to go talk to the doctor.
Yeah.
But if you're, been on that feeling okay track, you exercised moderately the day before, it's probably okay to push it up a little bit, and you could get up to 150 beats per minute, sort of 75% of your max.
All right.
And then day 4, you can probably return to normal if symptoms are gone or almost fully resolved.
Yeah. All right.
That makes sense?
Very useful.
Just take it easy, do a light day. If things are going well, do a slightly heavier day. By sort of 4 or 5 days, if it's just a cold, you should be fine. With the flu, probably going to have to take a few more days because your fever and your symptoms will last a bit longer.
But again, kind of the key is stay away from people.
Yep.
So even if you're feeling well enough to move, doesn't mean you're well enough to go to the gym because you're
Yeah.
still going to be spreading it around.
Take the dog for a walk.
Yep.
They won't get
Yep.
it.
Go into the sunshine, kill some bacteria or virus. I don't know. Oh, I still get confused.
Have a shower.
Have a shower. All right. Well, we are going to finish off by talking about Manflu, I think. But before we do, let's talk about our sponsor. Right?
Yeah.
Yeah.
It's
Sorry.
really exciting. I'm excited.
I actually am so beside myself with excitement. We didn't get like an external sponsor. We decided we would get our awesome LMB Escapes Bali retreats to sponsor this podcast. That's us. We made them. But anyway, we're so excited. In September, the 20th to the 26th, we are taking a group of cool people to Bali. And we're pretty much going to have the best time ever. Tim and I have been to Bali a lot. We love it. We have such a better understanding of Bali than I think what comes across to most people when they think of Bali. It is not just bars and smelly, cheap beer and shops, which if you like that, there is that there if you want it, but it's so much more than that.
Okay.
Tim had 3 ideas about why he thinks you should come because, look, we have a few rooms left.
Yep. Top 3 reasons you should come with us. to
Yeah, with
Bali
us, not
on
just...
LMB Escapes.
Yeah, on LMB Escapes. Let's go.
Number 1, you get to escape Australian winter.
Yes.
Okay,
So,
it's just
all
at
right.
the end of September.
Technically,
Days
it's
are getting
spring,
longer
but it's
already.
cold.
Yeah. By the time you get over to Bali to just near the equator, it's going to be sunny
It's
and
just
warm. And by the time you
beautiful.
come back, spring will have
Full
fully
swing.
sprung.
Full swing, yeah.
Yeah.
So we did this last year. We went in September. We've been in pretty much every season. But last year we went and it was a great way to cut the cold short. And we came back and we were all pumped and fresh. And hey, it was already back into sweet weather for Australia. So that was fab.
Number 2,
Yes.
it's just going to be heaps of fun. We've got heaps of activities planned. We're doing different kinds of workouts every day.
And yoga.
A bit of stretching and yoga, some HIIT training. We're going to go to the cool CrossFit gym near where it is.
Yeah, it's pretty awesome.
CrossFit Wanderlust. It's going to
Yep.
be fun. And it's going to be like an intro class. If you want to just... If you know what you're doing with barbells, you'll be able to go in and just smash some stuff.
Yep.
But we're also going to line up just a special group just for the LMB Escape guys, and
Yep.
they're going to get a chance to practice doing some deadlifts and maybe some cleans. It's going to be
yeah.
really good. We're going to go do a day trip in Ubud and check out.
No, actually, we're going to take them there for a whole night now.
Yeah.
Yeah, we're going to...
Walk around Ubud for a whole
It'll
day.
be beautiful.
Then stay there that night, and then we're going to go climb a volcano.
Yeah, we'll
See
do
the
that.
sunrise on top of one of the tallest bits on the island.
And so this is all things that it's like all the best things that Tim and I have done in our multiple Bali visits all rolled into one awesome time. And we've also made sure there's plenty of downtime on the retreat too, because we want everyone to just have space and time to explore or to just chill out. We want that week to
Go
be
find some cool cafes.
to be whatever you want it to be when you come. So, you know, if you have no idea what you want to do, you can stick to us like glue and we can show you a really good time. But also there's going to be the opportunity for you to do your own exploring each day. So, yeah. What's reason number 3?
It's really good value.
It's such good value.
Yeah.
Yeah, we're
We're not really doing it for the money.
No.
We're just doing it because we want to take people to Bali and have a good time.
pretty much. It sounds lame, but all this
so
effort.
all the info is on the website. So if you go to livingmovingbeing.com.au
No.
or to
www.lmbfitness.com/escapes.
that's probably the best one.
That's the one to go to. Mind you, if you follow at LMB_escapes on Instagram, you'll be able to see a bit of a glimpse. Look us up on YouTube as well. There's a couple of promo videos there and videos where Tim and I answer questions about the retreat. Okay. Anyway, be there. We love you.
Manflu.
Manflu. Is it or is it not a thing?
Chris, what's your opinion?
Look,
Have I manflued the last week?
no, you're an exceptional male specimen. I feel
you.
like
But was I manfluing?
No. You're no more sooky than I am with a cold. You're fine. But
Thank you.
I think it's more of a contrast when you have a cold. Do you know what? Because
Because
usually...
you're sooky all the time.
Yes.
And so a cold doesn't change you.
Yes. Now I regret saying that, but yes. No,
So when
what
I
I
ask for a
mean
glass
is...
of water, things are going very badly.
He's like, Chris, is that you?
Can I have a glass of water?
Yeah, no, I personally don't think that the men in my life are particularly man-flu-y.
Well, why does it exist? Why is there sort of that meme out there that wants to rag on men for, daring to be human and succumbing to
Here's what I think,
viral
Tim.
things?
Here is what I think. I think that when a man has a cold, because the stereotype of man is to be impervious to such things and to be, just really resistant to anything taking them down.
Mm-hmm. They're meant to be stoic. They're meant
Yes,
to be resilient.
I think they
strong.
some men perhaps think that they have to just say just how bad it is because they don't like showing the signs of weakness. Whereas a woman doesn't feel, this is a generalization.
Okay.
We're happy to just admit that, yes, we have a cold and deal with it because
no big deal.
things need to be
It
done.
doesn't change my worldview about myself.
Yes. I don't know.
Okay, there may be something to that.
Yep. But is there anything scientifically that men get more afflicted than women?
Well, there's theories. There's nothing in decent, hard evidence because, describing how sick you were is really sort of subjective.
Really subjective,
experience.
yeah.
Like, how ill do you feel? 7? Like, what does that mean? So it would definitely depend on the way you've been brought up, the way you've had previous experiences, the way your parents treated you when you were sick, the way they treated themselves when they were sick.
Goodness, that's a whole nother podcast.
There's probably a whole bunch of social sort of psychological stuff in there that is different between men and women in our society, and there's some theories out there sort of biologically that the estrogen that women have more of compared to men for premenopausal women might protect them from colds and flus, but it's not super strong evidence and it's just a bit of a theory, but there may be something to it.
Yes. I think what you said about the way your family has brought you up to think about illness is really interesting, and I think parents treat different siblings differently.
Yeah.
And like different people are different in their sickness threshold. Like some people are like, oh, I'm feeling so sick, I have to stay home. And they're not even sick.
Mm-hmm.
Like they're actually objectively not sick.
As in they do not have a temperature.
No, they just would rather not go to work, but they don't want to say, hey, I actually don't like my job that much. I don't really want to go, maybe I could sort of somehow claim that I'm sick.
Yeah. I don't feel good.
Yeah, I just don't feel so good.
My life's not working out.
Yeah.
Can I
feel
have a
sad
sick
for
day
me.
until September?
Yes.
When we're going to Bali.
Come to Bali. That'll make you feel better. No, actually, if you're one of those people, don't come. No, I'm joking. I love all people. But what I'm saying is, if
I'm
you...
fine. Look, if
if
you're a
one
whinger,
of,
don't come.
Yeah, if you're one of those people who is finding yourself taking lots of sick days when you know you're actually not even symptomatically sick, don't be afraid to actually say, hey, do I actually just really not like my job? Maybe I should get proactive and make a change. Because I think a lot of people hide behind sickness when they
Heal
don't
the world,
want...
make it a better
Yeah,
place.
this is Chris's
for
gold
you
life
and for
advice.
me and
Shush. What I'm saying is, don't be afraid to be honest with yourself and with the people around you when, because we're all afraid to admit if we don't really feel like doing something.
Mm-hmm.
That goes for social stuff as well. Oh, yeah, I'm sorry, I can't come because I have to feed my neighbor's cat because they asked me to and they'll die if I don't. No, just say, no, I can't, I could come, but I would actually rather stay home and watch The Bachelor. Like honestly, that's what I would prefer doing to spending time with you.
Yeah.
I'm no offense, but
if your friends don't dance, then
if they don't dance, then they're no friends
friends
at all.
might. Is
But
that what you're trying to say?
Well, yeah, what I'm trying to say is I think we need to be less BS-y, more authentic, still be polite about it, but
I totally agree.
yeah.
Yeah, and it's a massive false economy to be like, oh, I'd love to, but I just can't because of something
XYZ
very
excuse.
important. That temporarily inflates your ego because
Yeah.
you're so busy and so important and you get to make them happy and make someone else happy.
Mm-hmm.
But it's so much better just to own up straight away and just be like, thank you for the invite. No, thank you, because
Yeah.
I'm actually prioritizing this aspect of my life. So instead of going to the pub on a Friday night, I'm going to go do park run on Saturday morning and go smash it, because last week I almost broke my PB, but this week I'm hoping to just get underneath 20 minutes, and drinking is not going to help me run faster. And if your
but
friend's like, what's park run? Then you
some-
bring them. And if they
some-
don't want to come, you stop being their friend.
Some phases in your life, though, you might prefer to go out and do the social drinking.
Yeah, but
it's
if
all
you
it's all
prefer
fine.
to do that, then do it.
It's your
but
priority.
don't pretend you'd prefer to do
Yeah.
it and then in secret go do something else, because
Yeah.
why do you still want to be friends with the people that do things that you don't want to do?
Oh, we are dishing out the life advice today. So if
I
you
feel like
don't
Marshall going like full Oprah.
Yeah.
Oh, girlfriend.
Testify. No, yes. If you find yourself not wanting to go into work and you're just dragging yourself there and hating it, reevaluate. I know it is not as simple as that, and you might have to be patient
Yeah,
and
no.
stick it out for a
Take
while.
a mental health day.
But
Make a list.
figure out what you want to
Call
do
your
in your
mum.
life. Call your mum. She has great advice. Tim's mum has fabulous advice. No wonder you said that. She's great. Level-headed.
Yeah.
Shout out to Desley.
Hi, Des.
We love you. All right. I think it's time for us to go.
Okay, let us know what you think about Manflu. Let us know whether you've had a cold or the flu, and how
do you
that
go into
affected you.
work when you are sick?
Was it your
That's what we
biological
wanna
gender
know.
or your social gender that made that such a bad experience?
Okay,
And
so
maybe send us a suggestion for the next episode.
here is where you can contact us. info@livingmovingbeing.com.au. That's our big fat brand, by the way, Living Moving Being. It's where we do everything, all the
Or
things.
you can check out the Welliverse on Instagram.
You can.
The Well-averse. It's like a universe of wellness.
Yeah, we're so clever. Oh. And yeah, email us with any topic requests because we absolutely love knowing what you want us to talk about.
See you next time.
Bye.
Thanks for listening to the Welliverse.
Dum, 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 dum.